In the past, people probably used exorcisms to try to help people with D.I.D. manage their symptoms, and boy am I glad medicine has improved since then. Contrary to what many doctors might think, D.I.D. isn't necessarily curable like a lot of common ailments. It's something known as chronic, which means it'll go on for a long period of time or even your entire life. I know that might sound pretty scary, but bear with me here. While there may not be any medications that completely cure D.I.D., there's definitely some medications you can use that will help manage the symptoms. Some of them will help with comorbid disorders, switching or not switching, and some can even help with mood fluctuation. So let's get right into these. So the first one I'm going to go over today is selective serotonin reuptake inhibitors. That's like the longest word ever. I mean, it's 4 words, but still. And you can abbreviate it as SSRIs, so that's just what I'm going to be doing for this video. Like in the name, selective serotonin reuptake inhibitors, they affect the levels of serotonin in your brain. And serotonin is one of the chemicals that you find naturally in your brain. It's a neurotransmitter and mood regulator, and it can help with random things like appetite and digestion and libido, which is kind of cool. So if you have an imbalance in serotonin, then things could just be all around weird for you. Sometimes they're paired with beta blockers, and those can lower your blood pressure, and those can be used to help with anxiety. Like we take the knockoff version of Effexor, and we have that paired with hydroxyzine, which is a blood pressure lower / allergy medicine, and that helps with the anxiety and the depression, which is good. So currently we are taking Effexor, or the generic version, which is, I don't have the bottle on me, but I'll put the word right here when I go and find it after I finish filming. So there are a lot of medicines that are used in combinations with each other, and that can be pretty helpful. They can tackle both the depression and the anxiety symptoms, especially if one medication is lacking in one space or another. Another one we've had experience with is the generic version of Lexapro, which both us and the Acrylic chasers have had experience with, and that was not one of the more positive ones. That made it really, really hard to switch. Like, imagine in cartoons how there's like a muddy slope and people are climbing up but keep like sliding back down. That's what it felt like when we tried to switch, and it was a pain in the butt. But we've also known systems who have had positive experiences with it. If you have like too much switching going on, that may be something you'd want to look into. Like, not all medications are good for everybody. Like, everyone will have a different reaction to it, and sometimes it's the game of like trying to search around and find which antidepressant is proper for you. And that can take some time, which is pretty inconvenient, but in the long run you'll be thankful that you looked around instead of just settling for the first one if the side effects are just like really inconvenient or make your life even more difficult. Another type of antidepressants are M.A.O.I.s. I forgot what they stand for. I should look up what they stand for. Okay, that one is monoamine oxidase inhibitor. And these ones are still used, but not as commonly. They were more so used in like the earlier 1900s, probably like 1950s, I don't know. But since medicine has progressed on, they went more so to the SSRIs, which is nice, because with M.A.O.I.s, you have to avoid things like beer and aged cheeses, because that could like literally kill you. And I'm not about that life. I enjoy my beer and cheeses. Anti-anxiety medication is another thing that can be helpful with D.I.D. Like, we have tried both propranolol and hydroxyzine, and both of those are pretty nice. We usually take the ones that are take as needed, and there are also anxiety medications which you take daily, and they kind of keep you at kind of an even level, rather than having spikes of anxiety and then like taking a pill right about when one is about to strike to keep you back to your baseline. The long-term ones keep you at like a solid baseline, and that's a lot more helpful for some people than the take-as-needed ones. And I've also seen people who've taken antipsychotics, and that word is just terrifying to think about, antipsychotics. Like, you're not psychotic for taking antipsychotics, trust me, you are good. But yeah, some people have taken those, and those are more so to stabilize mood and prevent any other symptoms that may be comorbid as well, because there are a lot of people who have both D.I.D. and schizoaffective disorder, or schizophrenia, or things like that that would cause some sort of distortion in perception of the world. And antipsychotics could really help if that's one of those comorbidities that you have. And now, I know this one's a little bit controversial, but I would certainly put marijuana on here as a medication. We are a very big advocate for medical marijuana because you see a lot of usage for that for many things and many positive results. I know people think like, oh, it's a drug, drugs are bad. But if you get the type that's more centered on CBD rather than THC, THC is what like gets you high and stuff, and CBD is very much so pain relief. It helps you calm down. It helps keep things very even, and it's really just like soothing and calming, and it even helps you sleep and eat, which is great because we have problems with all of those things. So if that's not something that bothers you, I would suggest giving it a try, and if it's legal where you live, like don't go breaking the law. For people who are in places where marijuana is legal, I would certainly give that a try if medication is not something that you're interested in, because I know a lot of people are iffy about putting chemicals in their body, especially if they're synthetic, and that's totally fine. There are plenty of alternatives out there for medication, and marijuana, I think, is one of them. We use that quite frequently, particularly Parsifal, because he holds a lot of trauma and a lot of PTSD, and that really helps to keep him calm. And it helps everything to be a little bit easier to digest, and I definitely enjoy those results when it comes to him because he's a little bit of a loose cannon sometimes. So a question that you may ask is, what does medication do for D.I.D. specifically? What could it affect, and what does it really do to everybody as a whole? So it can aid in communication between alters, but it could also inhibit it. So this is where you gotta be careful, and trying new medication is definitely a good thing with this part, because sometimes it could help you communicate more with your alters, and sometimes it could make it more difficult, make things feel more foggy and staticky in there, and that may not be something you're interested in. So definitely, like, try it before you buy it. Don't go long term on something if it makes you miserable. Take care of yourself, that's important. And some medications can also help with dissociation, especially when it comes to dissociation that results from anxiety. That's where the anxiety medication would be good, because those can be grounding and they can make you feel calmer, and especially like if your anxiety leads directly to dissociation like ours does sometimes, getting rid of that anxiety would be helpful, just like straight off the bat, like no anxiety. I'm gonna take this medication, and if I eliminate this anxiety, I will eliminate the resulting dissociative episode, and that's really helpful. So there isn't really a one-size-fits-all thing when it comes to medication and D.I.D., so you really have to kind of find the combination that works for you. Like, this is a very individual thing. Like, there's there's no universal cure, although I've heard that there is a medication in the workings that helps with dissociation specifically. I don't know the name of it or anything, I just heard like a rumor about it on D.I.D. Facebook. But if that's actually a true thing that's happening, that could be helpful for a lot of people, and I look forward to seeing positive experiences with that. So, yeah, I know I say that this isn't a one-size-fits-all thing, but D.I.D. is a very unique disorder. Like, it's as unique as the minds of the individuals with it, so you can't really take a universal approach with this. You really gotta walk to the beat of your own drum here and not be afraid to try new things, especially when it comes to medication, because for a while there, after the Lexapro, we were just like, no, no more medication, until our depression got like really bad and it affected our dissociation and made everything feel like it was in a fog. So take care of yourselves, be careful when trying new medication and stuff, keep an open mind and everything, and you could just find a combination that works really well for you. Good luck on your journey of finding a good medication if that's what you're out here for. And these are some of the effects that medication has on D.I.D. If you have any more questions, feel free to leave them below. I don't know everything about medication though, and specifics might be a little weird because, you know, we're not a professional. I mean, we're getting our psychology degree, but that's in the process. We don't have training. We just go off of our own experiences here and some research. But yeah, we might be able to unprofessionally answer some questions that you have, so feel free to ask away. Thank you guys for watching, take care, and we'll see you all in the next video.